So right off the bat, the term red flags is just super misleading. Symptoms of mental disorders don't just show up in your face as if they're some big movie star. They usually sneak up on you much more subtly. And when you do know about them, there's a massive amount of stigma that comes with it that just makes it so much worse. So today, we're talking to Ms. Devika Dharmaraj about just this. Ms. Devika is a mental health first aid instructor, a certified executive coach, a leadership trainer, a very senior human resources professional, and most importantly, out of all of these, she's a parent. So hello, Ms. Dharmaraj. It's so good to have you here on TeenWork.
Thank you for having me, Aryan.
So I'd like to just dive straight into the questions. And this first one is actually kind of personal for me. See, when I was around 10 years old, I was actually identified and diagnosed as having ADHD. And at the time, we didn't actually really know what it was, but we caught it early. We found the symptoms, the red flags, whatever you want to call them, and we caught them early. But this doesn't always happen for everyone. The red flags aren't always obvious. So how would one catch the subtle signs that a teenager is struggling?
So that word you used just now, no? Subtle signs, that is the problem. When it is subtle, it very often is not caught at all, right? And especially in teenagers, because that's when all the hormonal changes happen in the body. So there are bound to be changes in behavior, in mood, in thinking, all of that, right? So where does one draw the line between normal growing up hormonal changes and something that might be a little, for want of a better word, a little dysfunctional to your daily life? Yeah, so that is, it is always a challenge. So it's only when the symptoms are a little less subtle that it is picked up on during teenage years, unfortunately.
So you're saying that most teenagers essentially suffer in silence before the signs begin to get really bad, and that's when intervention needs to happen.
Yes, that's right. When the signs are there and you don't know about them, that's when it goes unattended. But if people know about what to look for, yeah, and then they notice that these signs, even if they're subtle, if I know you really well and I notice that there are some changes in how you are, and that these changes are continuing, they're not short term, right? And they're there for a period of more than a couple of months or so, then some little alarm bell should go off in my head if I know you really well. Yeah, which is why we say that connection and communication is so important in those years, especially whether it is with your friends or your family or with anybody close to you.
So on a certain level, it's up to the person themselves to reach out.
Oh, definitely. Big part of it is the ability to speak, the ability to articulate what's happening to you. Yeah, I think that's like 50% of it, because it's really difficult for an onlooker to catch all the signs, especially in teenagehood, because a lot of teens, especially nowadays, many teens do much of their socializing alone. If you know, I mean, it's a little paradoxical, but a lot of the social life of youngsters nowadays is online. Okay, where reality is kind of warped, right? And youngsters are not so comfortable to wear their heart on their sleeve, and people don't see the day-to-day little changes that might otherwise be apparent. Yeah. So if somebody is locked up in their room on their laptops or phones for much of the day, and even family doesn't see so much of them or communicate so much with them, then it's difficult to catch these.
Next question is, can you give an example of what you'd consider a healthy and an unhealthy coping mechanism that teenagers commonly resort?
So many. As you probably know, with ADHD, that I'm still talking about ADHD here, although that's only one of the things that could affect young people in terms of mental health. Some symptoms are just lack of being able to focus or concentrate, not able to organize yourselves, behavior that is very inward focused, sometimes, restlessness, not able to sit in one place and focus on something for a period of time. When it can even be the other extreme of into hyperactivity, it can even be inattention and procrastination and putting off things, having trouble doing activities that need to be done at a certain time. So, and these are all normal. Yeah. So how do you catch these? It's when you say being impulsive, does that mean teenagers are not impulsive? They are. But when it is impulsive to the extent of you pass a you pass a store and you see something you like in it and you go in and buy it even if you don't have the money for it. Yeah, it's an impulse. Yeah, you see a picture of something and you go and get yourself tattooed. So these are impulses. It's not that it's not like you planned to have that tattoo and that you've made an appointment and that you've designed it and that you've spent like a month or two thinking about it and then gone and done it. It's like, oh, my friend's got it, I'll also do it. Or I see it in the shop, I see it past the shop and I jump in and have it done. That impulsive.
Right.
Yeah.
Right.
So some of those things can be dysfunctional. And when you're talking about coping mechanisms to deal with these kind of issues, I think alcohol and substances, really. Yeah, alcohol also is substances. Because the substance probably will help in the short term, but obviously in the long term, as we all know, it's like really bad for people's health. Yeah. So that's one coping mechanism. It is a coping mechanism, but not a healthy one.
Yeah, not
a really scary coping mechanism that I've seen on the rise in the last 15 years or so. Is self-harm. And that's like really scary too. It's really scary for the family, it's scary for the person, it's scary for for everybody concerned, I think. But it is a coping mechanism. So healthy ones.
Yeah.
You want me to talk about the healthy ones also?
As well, yeah.
Having somebody that you can lean on at those times, yeah, rather than go into a spiral of loneliness and isolation, as opposed to being with somebody and talking to them.
So that's building human connection, essentially.
Yes, building connections, building relationships, and using those to lean on when you need when you need an outlet. Yeah. Exercise. Those who are regular at exercise or athletes, or they will, the endorphins that are released are magic for coping with low moods.
Right. Yeah, absolutely.
Yeah. What else? I think a routine, having a routine really helps. Being, waking up, I'm saying very simple things, but they make such a big difference. Just waking up at the same time every day, having your meals regularly, staying hydrated. If you're exercising, then doing that exercise or doing your exercise at more or less the same time every day. That kind of routine really, really helps. And what that leads to also is a good sleep pattern. So sleep is another big, reason that especially young people tend to, fall off the edge sometimes because sleep patterns are just so irregular.
Hmm.
So that's the big medicine is sleep, I've found.
Right. So essentially just making sure someone is physically healthy and has a reliable support system of people they trust.
Yes, those are very big uh, requirements in staying well.
So our next question is that there's a lot of stigma around teenage mental health and overall just people's mental health, not just teenagers. So people can talk, people label people, people say horrible things, So how would a teenager and their family deal with this?
May I tell you how we dealt with it as a family?
That would you feel comfortable talking about it?
Yes, I'm fine. I have my daughter's permission
All
to
right.
speak about it. So.
All right. Thank you so much.
So I'm sure there were signs of poor health, poor mental health right through her teenage years, but we didn't catch it. Yeah. So I'm still fuzzy about what was there and what could we have done. But when my daughter went off to university, she had, I think from her second year onwards, it was very rough. And we only knew about it when she had a couple of breakdowns and then spoke to us about it. Pleased that she was able to talk to us about it because all the psychiatrists, the counselors, all of them told us that it's great that she's talking about it. So from that, I gather that many youngsters are unable to talk about it to their families. So then they suffer in silence. And when they do tell their families, it is apparently greeted with as something that is something that they can help or that they can control. Yeah? So then that's the attitude that is taken. So I've realized that the change in thinking happens with education. When family members and friends circles are educated about what is mental health, yeah, and they're able to look at it in the same way that we look at physical health, I find that their reaction to it is very different. So they are then more supportive. Yeah, it's like if the child had typhoid, how would they react? Right? They would be willing to go to the doctor, willing to hospitalize, willing to medicate, willing to support, all of that. Yeah, and not possibly not be unwilling to talk about it to other people as well. Yeah. So short answer to your question is we need to normalize conversations around it. As long as we're not willing to talk about it, there will continue to be a stigma. And we're only willing to talk about it if there is a little more education around it and people know what it is.
Okay. Thank you so much for sharing such a personal story. Now, this is coming back to what's written in your bio here. It says that you're a mental health first aid instructor. So what is mental health first aid? And would you say that every parent and teacher should be trained in it, or even teenagers themselves?
Ideally, in an ideal world, yes. So the program itself, mental health first aid itself is a program, a course that teaches you about what is mental health, teaches you to recognize signs and symptoms of declining mental health, and teaches you to recognize a mental health crisis when it is happening. Yeah. So a mental health first aider is not a professional. You're not allowed to diagnose or treat or anything. You recognize it and you're trained to guide that person to appropriate professional. Yeah. So that's that's what the job of the role of a mental health first aider is.
So it's essentially the same as physical first aid, where
absolutely
they themselves aren't trained to, let's say, treat someone who has a terminal illness, for example. They can't treat them, but they can get them to the help that they need.
Exactly. Yeah. So if I'm walking on the street and somebody collapses in front of me, and I'm a first aider, I at least know whether the person, I can check pulse, eyes, all of that, and check whether the person's having a heart attack or a stroke, and do what is necessary at that. I'll know what to do at that point in time to keep that person going until help arrives. And I know what help needs to be, sought as well.
Yeah.
That's important. You need to know where to reach out for help. Yeah? So, answer your question, I don't think it's necessary for all parents and children and everybody to be trained in mental health first aid. One, because people may not be willing to put in the time and effort that is required to do so. Yeah, and pay for it as well, because it is not a pro bono course as far as I know across the world. But just the awareness, of what it is, and the awareness that mental illness is not within the control of the person who is ill. It's like saying, don't have malaria or don't have diabetes.
Yeah.
It's that.
Exactly.
But what you can do is educate the person on what it is and help them manage their lifestyle so that it doesn't get worse.
So one thing I wanted to ask you is, would you say that people treat patients differently? Well, not patients, but people, differently post-diagnosis of a mental disorder when it's actually known, when they disclose that, prior, versus before that, when they don't know about this, when it's just the symptoms with no label attached to it?
Oh yeah, absolutely. But it has to come with education around the problem also. It can't be just a diagnosis, because a diagnosis doesn't mean anything to somebody who doesn't have enough information about poor mental health or mental illness. Now, if you know that somebody is feeling a certain way or behaving a certain way because of poor mental health, or because the mental illness makes them do certain things or feel certain things, then the judgment against that person is less. And the way we communicate with that person becomes a lot more non-evaluative. It's unconditional. Then the communication is unconditional. Yeah. So yes, it does make a difference. But the caveat attached to that is it makes a difference with information, not just the diagnosis. If I know what's going on, and if I know that it's happening because of an ailment or an illness, then the compassion I have it kicks in rather than
be more.
Yeah. So then I speak or I communicate from a place of compassion rather than a place of judgment.
Thank you so much for answering. Again, thank you for sharing such a personal anecdote, or personal experience rather.
My pleasure.